Hi there, Emmy Vadnais here. How are you? I want to share with you something that's been on my mind quite a bit lately. How long does an emerging practice area need to emerge? I'm a healthcare practitioner and I'm an occupational therapist, and I have been working in the field of what is now referred to as complementary and integrative healthcare, often formally referred to as complementary and alternative medicine. But since there's been more efficacy-based research, it is now referred to as complementary and integrative health for most approaches like yoga, meditation, massage therapy, aromatherapy. The jury's in. These approaches help in many ways for people. They're not a panacea, but they are very profound and definitely deserve to be at the table among all the other great healthcare tools that are available to people like you and I. So I've been contemplating this because, for example, I've been guest lecturing at universities, occupational therapy universities, for the last few years. And in fact, just yesterday, I was invited and I spoke at Hofstra University. I had the great privilege and honor to speak to the students in their emerging practice area class. And it's interesting that I'm invited to speak in that class, and I'm grateful that I am and that I was. But I noticed that these topics are still being relegated to being emerging. And so I'm wondering, how long do they need to emerge? And because complementary alternative medicine had been relegated to being outside of mainstream healthcare, and now that there's more research that it's can be used in mainstream healthcare, there's a trend for more practitioners to bring these approaches into their practice. And I'm certainly one of them. I've been doing it for over 20 years now, and I teach healthcare practitioners continuing education on how to do this as well. And even the National Center for Complementary and Integrative Health, the US government agency that provides research on these topics, changed their name, I believe it was in 2014, from the National Center for Complementary and Alternative Medicine to the National Center for Complementary and Integrative Health. So that's a clue there that these approaches are not really, many of them are not really alternative anymore, because there's scientific research that shows that that they are statistically significant to help people with many aspects of their life. It's too long to list here, but I want to stay on the topic of what we're talking about here. And in fact, the Joint Commission that accredits healthcare organizations, JCO, created a standard just a couple years ago that all of their organizations that they accredit need to have an approach that's offered to people, their patients, their clients, that is a non-pharmacological approach. And many of these complementary integrative health approaches just shine in this area. There's chiropractic care, massage therapy, relaxation techniques, meditation, acupressure, reflexology. I could go on, energy healing, Reiki. And so, in my opinion, the evidence is there. The research is in. It's not saying it's a panacea. They don't work in 100% of the cases, but they work in a majority of the cases at a minimum, which is profound, is helping to lower even stress, anxiety, and pain, which really impact people's ability to function all across the lifespan. So I just want you to consider within yourself, how long does an emerging practice need to emerge? And at what point when is it even beyond an emerging practice and just a special interest area, which I think it is for nursing and for medical doctors. In the field of occupational therapy, it seems to be still considering to be coming out of the ooze and forming. I think it's actually already greatly formed. And when does it then just become healthcare and just part of healthcare, just other tools in healthcare? And I'm thinking that part of it is that we need to have maybe some new language for complementary integrative health. What do you think? Because again, if we're calling it complementary or integrative, it implies that it's sort of outside of and it needs to sort of come within versus that it's already accepted. And I also think that because these approaches, there's so many different types of these approaches, and I listed a few, that I think that, maybe we just call them by their names, their particular approaches. I don't know what the answer is. Or maybe because a lot of them address the mind-body simultaneously, the mind-body-spirit, maybe there's another term. This is why I've called the holistic OT community versus integrative health OT. I've called it holistic OT is because it works holistically or multidimensionally with a person. So I don't know what the answer is with that, but I just want you to kind of think about that. What kind of language might we need in order for it to be not considered even sort of outside or separate with being implied by using the terms complementary and integrative? And also, I think one of the areas that we could improve upon is having more healthcare professionals educated in these approaches and to help bring it forward so there isn't that disconnect of it. If a practitioner, and I think the stats are, I've heard various different stats, but I think we might still be about less than 50% of healthcare practitioners. It's grown as far as how many practitioners are using these approaches, which is excellent. But I think we need to get to that tipping point as well. And that's why I'm providing education as a continuing education provider. And one of my missions is to help educate as many healthcare practitioners as who would like to be in these approaches, because I really think that all healthcare practitioners need to have at least basic understanding and knowledge. And even if you as a healthcare practitioner are not interested in providing these, to know the efficacy-based research behind them and who you could refer to. And so I think that these are just some of the areas that we can improve upon, is to look at recognizing that these approaches do have the research for us to become more educated, for us to help educate our fellow healthcare practitioners, and to look at the terms that we're using to describe these. And I think for now, this seems to be the term, but maybe as more healthcare practitioners become educated, maybe the terms will change. So I just wanted to share that with you, is to let you know this is something that's been on my mind. I'd love to hear your thoughts. If you want to share with me any ideas you have on this, or what we can do to help share with more people. And it doesn't even just have to be healthcare practitioners. There's people who are not healthcare practitioners, and maybe you yourself listening to this, maybe you're not a licensed healthcare practitioner, and maybe you do practice yoga. And so, there are more people who are not healthcare practitioners doing this. And in fact, a big reason why complementary and integrative health has grown from being considered complementary and alternative medicine is because it's the quote consumers. It's people like you and myself who use this, who are asking and demanding our healthcare practitioners to guide us in these approaches and to use them. And to many people, don't want to use as many medications, and they want other options. And so that's really how a lot of this has become more popular. In fact, it's $1 billion industry here in the United States, by the way. And so it's something that people want. And I think that it would be great for more healthcare practitioners to be trained in it, because it gives more options of care for the people you're serving in a really beautiful way that can really impact their health and wellness. And we now know that 80 to 95% of chronic healthcare conditions can be prevented through healthy lifestyle choices. And that includes many of these options with complementary integrative health to help people to stay well, be well, or if they have a chronic condition, to be able to manage their symptoms better, to feel well. That's what wellness and well-being is all about. And in certain cases, there's even evidence that people can reverse their disease process through these approaches. So thank you for listening to me. I'd love to hear your comments, and Lots of love. Namaste. Have a beautiful rest of your day.